my name is Abby. I'm going to be your student nurse today. Can I just check your wristband? And can you tell me your name and date of birth?
Chesney Hammock, May 4th, 2005.
Okay, good. I want to wash my hands really quick and provide you with some privacy. Do you have any allergies that I should be aware of?
No.
Okay, perfect. So, Miss Hammock, today I'm going to be doing a head-to-toe assessment on you. Basically, I'm going to start from your head, go all the way to your feet, checking out your different body systems, making sure everything's okay. Okay, so I'm going to start with your head, and just upon inspection, your head is normal cephalic in midline. Do you mind if I palpate your scalp? Okay. Any pain or tenderness while I'm doing this?
No.
Perfect. There's no pain or tenderness upon palpation of the scalp, and there's no lesions or abnormal masses noted. Okay. Okay. Can you puff out your cheeks for me? Can you wrinkle your forehead? Scrunch your nose? Smile without teeth? Smile with teeth? Can you clench your teeth? Okay, my patient's facial expressions are symmetrical at rest and with movement. Cranial nerves 5 and 7 are intact. Now, if you don't mind just closing your eyes for me, I'm going to place this cup in your hand and I'd like for you to taste the contents. Let me know if it's sweet, salty, or sour.
Sweet.
Okay, my patient can correctly identify a familiar taste as sweet. Cranial nerve 7 is intact. Now I'm going to palpate your sinuses. This is the frontal, maxillary. Was there any pain or tenderness?
No.
Okay, my patient's bilateral frontal and maxillary sinuses are non-tender to palpation. Okay, now I'm going to move on to your eyes, and just upon inspection, I see no abnormal protrusions or scleral icterus. Okay, I'm going to hold this pin light right here, and if you could just follow it with your eyes and not your head.
I want you to follow the top of my head, just your eyes only without moving your head, okay?
Okay, there's no nystagmus noted upon the 6 cardinal positions test. Cranial nerves 3, 4, and 6 are intact. Okay, now if you could just look straight ahead, I'm going to shine this light into the corner of your eyes. Okay, other side. Perfect. And if you can just look over my shoulder, now focus on this as it goes towards your nose. Okay, my patient's pupils are 4 millimeters without light, and they constrict bilaterally to 2 millimeters when light is introduced. My patient's pupils are round, equal, reactive to light and to accommodation. Cranial nerve 3 is intact. Okay, now I'm going to do the red light reflex. I'm just going to shine this light to the corner of your eyes. You can just look straight ahead. Okay, good. My patient's red light reflex is intact bilaterally. Now I'm going to move on to your ears. And just upon inspection, my patient's external auricles are free from redness, crust, or drainage. I'm going to palpate them. Okay, was that painful or tender? Okay, my patient's bilateral external auricles are non-tender to palpation. All right, I'm going to stand on your left side. I want you to close or plug your right ear, and I'm going to whisper 3 words. I'd like for you to tell me what I said.
Cat, dog, red.
Okay.
Pig, cow, blue.
Okay, perfect. My patient correctly whispers back all 6 words in both ears. Cranial nerve 8 is intact. Okay, now I'm going to perform the Weber test for you. I'm going to take this tuning fork, I'm going to strike it on my palm, place it on your head. Tell me if you hear the vibrations equally or not.
They're equal.
Okay, my patient can hear the vibrations equally in both ears with no lateralization noted. Now I'm going to inspect your ears. Well, let's go. Okay. All right, I'm going to put up and back. Okay. Sorry, it's okay. Up and back. Okay, perfect. My patient's bilateral ear canals are patent. are patent with no crust, foreign bodies, drainage, or redness present. And my patient's bilateral tympanic membranes are shiny, pearly gray, translucent, and patent. And in the left ear, the cone of light reflects at 7 o'clock, and in the right ear, the cone of light reflects at 5 o'clock. Okay, now I'm going to move on to your nose and mouth. If you don't mind closing one nostril for me, breathe in. Other nostril, breathe in. Okay. My patient's nose is midline and bilateral nerves are patent. Okay. I need you to close your eyes for me. I'm going to place something under your nose. Now I'd like for you to identify the smell.
Alcohol.
Okay. My patient is able to correctly identify if familiar smell is alcohol. Cranial nerve 1 is intact. Okay. You don't mind opening your mouth for me? Okay, stay out your tongue. Lift up your tongue. Okay. My patient's frenulum, tongue, buccal mucosa, hard palate, soft palate, posterior pharynx, and uvula are all intact. They are pink and moist and free of lesions, and the uvula is midline. Okay, and the tonsils are grade 2. Okay. Can you poke out your tongue for me? Okay. My patient can poke out her tongue in its midline without difficulty and no deviations. Cranial nerve 12 is intact. Okay. And my patient's teeth are white and in good hygiene with no dental caries noted. Okay. I'm going to do a few tests. Can you swallow for me? Can you poke out your tongue and say ah? Ah. Okay, perfect. I'm going to place this in the back of your throat. Okay. My patient is able to swallow on command with no difficulty. She can poke out her tongue midline and say ah, and the soft palate and uvula rise and fall symmetrically, and her gag reflex is intact. Cranial nerves 9 and 10 are intact. Okay, now I'm going to move on to your neck. Okay. If you don't mind just looking up towards the ceiling for me. You pat your trachea. Is that painful or tender to touch? No. Okay. My patient's trachea is midline and non-tender to palpation. Okay, now I'm going to feel your lymph nodes. Let me know if any of it is painful, tender, preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and submandibular. See if that painful?
No.
All right. My patient's lymph nodes are non-tender to palpation, and there is no enlargement of bilateral lymph nodes. Okay. Now I'm going to check your carotid pulses and check for bruits. Okay. So I'm going to feel this carotid. Okay. This one. Okay. Carotid pulses are at a 2+ strength with an even rhythm. Okay. Now what I want you to do, I want you to turn your head to the left side. Take a big deep breath in for me. Out. And hold it. Okay. I'm going to do the other side. Do the same thing. Take a deep breath in. Exhale. Hold it. Okay, upon auscultation of the trachea, of the carotid pulses, there are no bleeds noted. Okay, now I'm going to move on to your skin, and just upon inspection, your skin tone is even and consistent with race and ethnicity. There are no abnormal protrusions or lesions noted. Just going to feel your temperature. Okay. And if you don't mind pulling down the neck of your shirt to your collarbone. Okay. My patient's skin is warm and dry to touch. Her skin turgor is good with no signs of tinting. Okay, now I'm going to move on to your respiratory and cardiovascular. Okay. If you don't mind, just turning to the side for me. And just upon inspection, my patient's breathing is unlabored and even. There are no lesions on the chest wall. Her AP ratio is 1 to 2.
said, I would usually in the soft part. The soft
1 to 2.
where it's aroused and flow.
If you don't mind breathing in for me.
Cranial nerves 9 and 10 are intact.
Okay, and her chest wall expansion is symmetrical bilaterally. Now I'm just gonna listen for your lung sounds on the posterior portion. Okay, anytime I touch this stethoscope to your back, you just take a deep breath in through your nose, out through your mouth for me.
Of the neck, no enlargements were noted, and the trachea's midline. Okay, now I'm going to palpate your lymph nodes. If you feel any pain or tenderness, just let me know. Okay? Submental, submandibular, tonsillar, preauricular, posterior auricular, occipital,
There were no bruises noted bilaterally.
superficial cervical, deep cervical, posterior cervical, supraclavicular.
Okay, you can turn back to the front for me. I'm gonna do the same thing just on your interior side. Okay, again, anytime the stethoscope touches your skin, you can just take a deep breath in through your nose and out through your mouth.
Carotid arteries were 2 plus and regular bilateral. Now I'm going to take a listen, okay? Every time you feel the bell touch your skin.
Okay, if you can move your left breast to the side for me, thank you.
Symmetrical, and there were no lesions or masses noted.
And can you please move your right breast to the side?
I'm gonna take a listen to lung
Thank
sounds.
you. Okay, just lift both breasts up for me.
The diaphragm and my stethoscope on your back.
Okay,
No bruises were noted bilateral. Okay, now from your neck, I'm going to inspect.
thank you so much. Okay, breath sounds are clear in all lung fields, anteriorly and posteriorly and bilaterally. There are no adventitious breath sounds heard. Now I'm going to listen to your heart.
I'm going to check your skin tone.
Okay,
Patient's skin
this is the aortic. It's in the second right inner space.
Now I want to assess your chest.
Okay. This is the pulmonic in the second left inner space. Now, if you don't mind pulling your left breast to the side for me, this is the tricuspid and the left lower sternal border.
Yes, to the left.
Okay. And this is the mitral in the fifth inner space of the left midclavicular line. Okay. S2 and S1 heart sounds are noted in all 4 locations with no extra heart sounds or murmurs. So what I'm going to do now is I'm going to listen to your pulses. You can stick your arms out like this for me.
Clear, and there were no
Brachial.
adventitious lung
Good.
sounds.
Radial. Okay. Posterior tibialis. If you don't mind taking off your shoes for me, please. Okay. Dorsalis pedis. Okay. Bilateral upper and lower extremity pulse points are 2 plus strength at an even rhythm. Now I'm going to check your capillary refill. You can leave your shoes off. Put your hands out like this.
On the second intercostal space. Okay. Now I want
Okay. Bilateral upper and lower extremity capillary refill is less than 2 seconds with no blanching noted. Okay, if you can just lay back for me, we're going to move on to the abdomen. Put this out for you. Hold on. You can rest your legs. Okay. I'm going to inspect your abdomen, and on inspection, your contour is flat and your umbilicus is midline with no lesions noted on the abdomen. Okay, now I'm going to auscultate and listen for your bowel sounds. Okay. This is the right upper quadrant, left upper quadrant, left lower quadrant,
Patient's breath sounds were clear in all lung fields.
right lower quadrant.
They're posteriorly and anteriorly.
Okay.
There were no
My patient's bowel sounds are no more active in all 4 quadrants. Now I'm going to percuss all 4 quadrants. Okay.
Now I'm going to check your pulses.
breathing exercises for this, okay? First, I'm going to listen to
Brachial pulses were regular
aortic
and
first.
2 plus bilateral.
Okay, there's a tympanic note heard in all 4 quadrants of the abdomen. Now I'm going to do palpation I'm going to do light and deep, and you let me know if there's any pain or tenderness.
Now I'm going to
Light
listen
palpation.
to your palmonic, which is left of the sternocleidomastoid.
The posterior tibialis pulses were regular and 2 plus bilateral.
Now I'm going to listen to your tricuspid, which
Any
is
pain or
the
tenderness?
left
I'm going to go ahead with deep.
And the
your versus to the
dorsalis
side.
venus pulses were regular and 2 plus bilaterally. Now
And
let's
lastly,
comment.
Any pain?
No.
All right. Upon palpation, there's no pain or tenderness in all 4 quadrants. Okay, you can just go ahead and sit up for me. And throw your shoes back on. We're going to do musculoskeletal and neuro, kind of mixing together. Okay, you can stand right here for me. We're going to do some range of motion exercises. I'm going to show you how to do them, and you can repeat them. So we're going to start with the neck. You can put your chin to your chest. Okay, head all the way back as far as you can. Turn it to the left side, to the right side. All right, put your head to your left shoulder without lifting your shoulder. Okay. Right side. Okay. Any pain or tenderness? Nope. Okay. Now we're going to go to the spine. You can just put your hands by your side. Slide your right hand down your your right thigh. Sorry. On the other side. Okay. Now put your hands on your hip. Turn all the way to the left as far as you can. All the way to the right as far as you can. Good. All right. All the way forward as far as you can. Okay. And backwards as far as you can. Okay. Is there any pain or tenderness?
No.
Okay. And now you can lift up your right knee and extend it out as far as you can. Okay. Left leg. And if you could just take your arms and touch your shoulders. Go out. Back in. Was there any pain or tenderness doing any of that?
No.
All right, my patient has no pain or tenderness while performing range of motion exercises. Okay, now we're going to do some neuro. I'm going to kind of mix it up. Okay, first thing I want you to do, stand feet shoulder width apart, hands by your side, and just close your eyes. Okay, next thing I want you to do is I want you to walk heel to toe. You can go ahead. Okay, come on back. Okay, my patient has a negative Romberg as she's able to keep balance, a steady balance while standing with her eyes closed. And my patient has a smooth and steady gait with the tandem walking. Okay, next what I want you to do, I want you to take your right heel and run it down your left shin. The same on the other side. My patient is able to perform heel to shin while keeping balance. Okay, you can take a seat. Okay, I want you to put out your hands like this. Alright, I'll squeeze my hands as hard as you can. Patient has 5 out of 5 with grip strength. Put your hands out again. I'm going to push down, don't let me push down. Okay, I'm going to push up, don't let me push up. Okay, same with your feet. I'm going to push down, don't let me push down. Alright, I'm going to push up, don't let me push up. Okay, my patient has 5 out of 5 bilateral upper and lower extremity strength. Alright, shrug your shoulders up for me, please. I'm going to push down, and let me push down. Okay. My patient has 5 out of 5 strength in her shoulders, and her shoulders move evenly bilaterally. Cranial nerve 11 is intact. Okay, now for our last test. Sure. All right, I want you to close your eyes for me. I'm going to have you differentiate between dull and sharp touch on your upper and lower extremities. For reference, this is dull, this is sharp. Okay. Okay.
Dull. Dull. Sharp. Sharp. Sharp.
Lean back as far
Dull.
as possible.
My patient had
Sharp. Dull.
Twist from side to side.
Dull.
My patient had no pain
Dull.
or tenderness while
Can
doing
you
Sharp.
bend
Sharp.
of the neck,
Dull.
back, arms, and legs.
Sharp.
And the
Sharp.
range of motion exercises were done
Dull.
smoothly. You flex your arms and
Sharp.
extend them out.
Sharp.
You can open your eyes. My patient is able to correctly identify the sensation of sharp or dull with her eyes closed on bilateral upper and lower extremities. Okay, close your eyes one more time for me. You can stick out your hands. I'm going to place the object in one of your hands at a time, and I want you to identify the object.
Paper clip. Coin.
Okay. My patient is able to correctly identify familiar objects in her hands with her eyes closed with no difficulty. I'm going to go check your paperwork.
My patient was able to hop on one foot and then change to the other foot smoothly and evenly.
I'm gonna have you hop on one foot.
Now, could you sit back down
Okay.
for me?
Now can you hop on the other foot?
Okay. That concludes your head to toe. Thank you.